that our people don't need to travel very far. They don't need to go to Eldoret. They don't need to travel to Nairobi to get specialized care. They'll be able to get specialized care in the counties in which they reside in. And then we are demanding that for every 100,000 people, there's a level 4 hospital. So this means that at least every sub-county, the 295 sub-counties we have in the in the country, have a level 4 hospital. Again, this brings healthcare closer to the people and ensures that they get the quality services that they have. And when we talk about these levels, it's not a designation that it is named a level 4 hospital. It becomes a level 5, level 4, level 3 hospital when it has the right number of staff and cadre, and it has the right number of equipment to take care of the patients. And then each ward must have a fully functional facility, so that for every 1,000 people, we are having a health center, a level 3 facility that can be able to offer minimal surgery services, maternity services, and our level 3 hospitals will operate 24 hours. And then we'll make a demand on the human resources because we have representatives, we have representatives of healthcare workers, right from level 1, the community health workers, all the way to level 6. So we will be making demands that, again, these standards are met across the country, and I'll just take us through what our gaps are and what we need to meet. So as you can see, based on the standards that have been set by the Ministry of Health, if we are to staff level 3, level 4, and level 5 hospital, we will need 20,700 medical officers and specialists. Currently, we only have in employment 6,000. So we have a gap of how many? Almost 13,000 doctors that need to be employed, and yet we have unemployed doctors out there who are seeking employment. We need 40,510 clinical officers employed, 163,945 nurses across the country. Right now, we are yet to meet even half of that. And we'll need 12,430 pharmacy staff, 16,370 dental officers. We will need imaging specialists, 6,410 of them. We'll need lab scientists, so the lab technologists, lab technicians, 28,800. And as we go through that number, even mortuary attendants, we need 5,170. We barely have 500 mortuary attendants in the country. So these are gaps. These are needs that must be met if our people are to get the quality or the kind of care that they need in the country or in our health, especially our public health facilities. And so what does this staffing needs, or what then do we expect when this is met? We expect that level 1, we will have community health workers who will be serving 500 households, and these will ensure that the 3 to 4 people in each household get health education, get linked to a health facility, and get treatment for the common ailments that do not require them to visit a health facility. And when we talk about a level 2 facility, this will ensure that if you visit a dispensary, you're able to get tested for whatever it is you're ailing from, and then you're able to get medicines and treatment. And then we move to level 3, as we said, a level 3 must have at least a medical officer, a pharmacist. You realize that when we have this kind of skilled workers at level 3, we reduce the number of referrals to the higher level facilities. We also bring quality healthcare closer to the Kenyans. So at level 3, we know that you can be able to get maternity services, and you're able to get some surgery done before being referred to the higher levels. And at level 4, we are talking about sub-county hospitals that are able to do higher level diagnostics and also handle very complex cases, and you do not need to travel very long distances to get this kind of care. And at level 5, as I said, we will also be having sub-specialized care at 5, and all the diagnostics and all the complex cases will be handled at this level. So because I am a trade unionist, afya yetu, afya yetu, afya yetu haki, afya yetu, afya nation, afya nation. Yes, we must talk about the well-being of health workers, Indio. Because if our health workers are not healthy, if our health workers are not taken care of, they will not then be able to take care of us. So we want the government that will come into place to commit to transferring funds to the county governments on time. This will ensure that we do not have salary delays, and the salary parades we see in our counties will become a thing of the past, Indio. Then these will also ensure that the working conditions are proper, and also our health workers are provided with comprehensive medical insurance and risk benefits. We also demand that all collective bargaining agreements signed with the various trade unions representing healthcare workers are honored and implemented fully, and that the government will not shy from engaging trade unions and representatives of health workers, but will embrace them and even allow us to form a trade union for community health workers. Indio. It is a constitutional right, and so we must move towards that. And lastly, before I welcome Diana to close, we demand that the governments, both county level governments and national governments that will come into power, will assure every Kenyan emergency treatment. So we demand that any institution, any healthcare institution across the country, public, be it private, that will deny a Kenyan emergency treatment, that will deny any Kenyan emergency treatment or diagnostics, be deregistered. And then at least 85% of the funds or the costs incurred by private facilities to provide Kenyans with emergency treatment will be refunded to make sure that they continue being operational. And we demand fully equipped and operational ambulances for every 5,000 Kenyan. Afya Nation. Thank you.
Afya Nation. As I move to the final ask of the People's Manifesto, I hope mmeelewa hizo numbers za madaktari, si ndio? Health center. Roysambu kuna health center ya serikali? Kuna kuanga na daktari, medical doctor. Inafaa kuwe na wangapi? Wawili, mpaka wanaenda shift. Pharmacist, doctor, pharmacist na pharmtechs. So these are things that we can easily monitor, na tunaambiwa kwa constituency ama sub-county, ukihesabu madaktari kwa hospitali wanakuja 16. Inakuwa kuna shift ya asubuhi, ya lunchtime, ya jioni, ya kabla ukulala, ya ukiota. We are covered, okay? And if you want to think, for me to bring this home, I'll give you two stories. One was in Tana River, where there is a level 5 hospital that has no water. And when we engaged community health volunteers there, they told us that there was a man, he was a man, he said he took the wife there. They have a new maternity wing. They were very excited. The wife was well attended and she delivered. But while the husband was there, she noticed another woman was waiting. But because there is only one nurse, the nurse has to finish with one woman, then wait for the other one. In that process, this other woman, her time came and she just delivered while walking. The baby landed head first on the floor, okay, and died. So when we say we need enough health personnel, that is exactly what it means. When my colleagues went to Kilifi, they heard of a story of teenagers who tried to procure an abortion. They went to some quacks, then they were given some medicines. The girl bled. One of the aunties rescued her, took her to hospital to try and get post-abortion care. There were no guidelines, so she couldn't be attended. But one of the doctors was like, let me take a risk. There was no blood for transfusion. This doctor tested, akaona damu yake inaingiana na huyu akaamua wacha nimpe blood transfusion. Directly as I treat. Okay? But even despite that, this girl died. And after that, the boyfriend was so guilty he committed suicide. How many more deaths must happen because we are prioritizing other infrastructure before we prioritize our bodies, our souls, and our well-being? Okay? Afya Nation. Afya Nation. So finally, we are calling on the next leaders to prosecute all Afya-related corruption and recover all our monies that has been stolen. Okay? There has been very many Afya scandals. Afya 1, Afya 2, KEMSA 1, KEMSA 10, COVID millionaires. Every county has a story of how health-related budgets are being vandalized? Zinaibiwa tu, zina embezzled. So first, that they tighten laws and strengthen investigative and prosecutorial action to convict thieves of public money. We want thieves convicted. Okay? We do not want thieves vying for office. Thieves should be convicted. Then ensure recovery of all proceeds of corruption in the health sector. They need to be recovered with interest and damages within 1 year of the new government coming into office across all the 47 counties. And finally, the ODPP, EACC keep saying they have collected a lot of money from proceeds of crime. That money that is recovered, if we are to attain an Afya Nation, then 15% of money recovered from acts of corruption need to be redirected towards strengthening the health sector. Asanteni sana. Afya Nation.
Health first.
Afya Nation.
Health first. Thank you.
We are not doing so well with time. We are 30 minutes behind, so I'm going to request that the representatives of the different institutions I shall be calling on to please take the shortest time possible. We'll pass the mic where you're seated, and we can honor you from your sitting position. Our first speaker, this is a team of members who are part of the caucus that guided in the development of the manifesto and the demands and the recommendations that we have today. I have Christian Aid Kenya, Abdul Guko will be our first. Abdul, you can come in front because you're first one. The second person who is going to speak is a representative from the students. I usually say, I know you guys say that the children eat after the elders, the millennials and the XYZ generation, we've toppled that up, so we speak first. Andrew Were, please prepare to speak, and then we will go to the Kenya National Union of Nurses, and then we'll do Aisha, who will speak for the community CUH. Abdul. Assalamu alaikum.
Walaikum salam. Good morning. Thank you so much to KMPDU, Amnesty, and all stakeholders. It's such a great opportunity for us to have this conversation as stakeholders, and we are at such a critical moment, especially with electioneering and COVID-19. COVID-19 really exposed our health system, which is really weak. But this gave us an opportunity as the public and citizenry in terms of us having a conversation